Good afternoon. I'm Rhonda Richards with AARP, and I'm going to make a few comments from the older adult consumer perspective and also the perspective of family caregivers. And also talk a little bit about the importance of the care team that you heard about and the importance of the team to providing care. Americans, as was noted earlier by other panelists here, Americans who are age 50 plus are receiving health and long-term care, long-term services and supports every day across this country. Whether it's in a doctor, nurse practitioner, physician assistant office, in their own home, receiving help from a direct care worker at home or in assisted living or board and care or in a nursing home, in a hospital, working with a social worker at hospital discharge, going to outpatient physical therapy, or the pharmacy. So a range of services, a range of places, a range of providers. 50-plus Americans are also family caregivers, and I use this term broadly: family, partner, spouse, friends, neighbors, who provide paid and unpaid care to their loved ones. This can be everything from rides to the doctor, help with errands, paying bills and money management kinds of things, to meal preparation and help with things like eating and bathing and dressing, the daily activities that we all do every day and take for granted that we don't need anyone to help us do them. And unpaid family caregivers actually provide the bulk of long-term services and supports in this country. The estimated economic value of their unpaid contributions was $375 billion a year in 2007. And that is larger than the total spending on the Medicaid program in 2007. That's federal and state contributions for both medical and long-term care. Those estimates come from our AARP Public Policy Institute, who's working to update those figures, and they'll be coming out next month, so watch for those. Older adults, as you heard about, also have unique health care needs. They have multiple chronic conditions. 4 out of 5 older adults have 5 or more chronic conditions. So conditions and things that interact. You heard about medication regimens and the importance of those. So this means, higher uses of hospitalization, prescription drugs, ER visits, etc. Older adults also tend to have a greater need for long-term services and supports. Again, the things like help with eating, bathing, and dressing. About 75% of people who are 65 and over will need at least some type of long-term care at some point in their lifetime. So again, sort of the many services, many places, and many providers. Oftentimes, as the older adult is going through the healthcare system and the long-term care system or lack thereof, they have a family caregiver who is accompanying them and helping them coordinate their care, a de facto care coordinator, if you will. But the constant throughout all of this, again, through all the providers and places and whatnot, is that older adult and oftentimes their family caregiver. And they need to interact with all these different providers and whatnot to meet the needs of their whole individual, the health, the long-term care needs, the physical, the mental, behavioral, social, etc. And if you were to do sort of a little headline of the presentation here, it takes a team. A competent interdisciplinary team with a person and family-centered approach to care, with the consumer and the family caregiver at the center as critical members of that care team to provide the care that older adults need. If you picture a wheel, the consumer and the family caregiver sort of at the center of the wheel, and all the spokes radiating out to all the different members of the care team and the providers. Thank you. So this team needs to communicate well. They need to work together and be able to practice to the full extent of their knowledge, their training, and their skills to provide that well-coordinated care that people need. And each team member's contribution should be valued. And you can make a sports analogy here, and maybe this is because I'm a Mystics fan, but if you think about basketball and you think about you've got your starting lineup, you've got your players coming off the bench, everybody needs to make important contributions and play well. The team members need to communicate so they know when a pass is coming, if there's an assist, who's doing what is the play. And if they don't communicate well and they don't do their jobs well, maybe a missed pass means a turnover or a steal, or maybe in a close game it means you lose a game. But when it's not a game, when it's actually life, and you have an older adult, for example, who's coming out of the hospital and needs to have a smooth transition, whether it's working with a home health agency, support for the family caregiver, links to community resources and supports and whatnot, if those kinds of things, and links to the primary care provider, if those kinds of things aren't in place, case, that older adult bounces back, pardon the pun, into the hospital. And that impacts the care for the individual, the family caregiver, the providers, and the healthcare system, and it costs money that it doesn't need to cost. Another thing is that's important is support for the family caregiver so that they have the help and things that they need in their caregiving role. Because oftentimes family caregivers take on responsibilities that can mean physical, emotional, financial stresses and strains. And whatnot. And so they might need information, they might need respite care, they might need support, they might need counseling, a variety of things. But if you support the family caregiver, that's not only helping the caregiver, it's helping the care recipient, and it's helping the other members of the care team that work with a family caregiver. So again, it's that team thing. Providers also need adequate and appropriate training and education to prepare and sustain a quality elder care workforce and meet the needs of older adults. Again, with the sports analogy, you wouldn't send the team out on the court without training camps and practices and workouts in the gym and warm-ups. Same kind of thing here. It's also important that culturally competent care is provided. The aging population, as with the larger population, this country is growing more diverse, and that means a variety of languages, ethnicities, cultures, health beliefs, and the workforce needs to be able to serve all older adults, regardless of their circumstances or their demographics. So that's important as well. So these are some of the principles that are in the Eldercare Workforce Alliance Principles for New Models of Care. It's in your packet. Suggest it would be a good thing to take a look at, because these are things that as you're looking at new systems of care, new pilots, new demonstrations, what are the kinds of care models we need to transform care to meet the needs of an aging population and make it work for everybody involved, for the consumer, the family caregiver, all the members of the care team. These are some elements and kinds of things that should be considered and should be looked at. So commend that to your attention. So again, the importance of the team and working together to provide better quality of care, more efficient care, care that works for everyone in the team. Thanks very much.